So what we're going to talk about this month, it's more of a sort of a lifestyle and keeping well rather than hardcore science. I thought we could have a little break from the too much science. So I've been reading a couple of really interesting papers lately about microbiomes that had some stuff that I picked out that could be quite relevant to a few people here. So how do teeth influence your lung microbiome? So the microbiome, you know this already, but it's everything on your body, all the germs, the bacteria, the viruses, some whatever weird protozoa. There's special kind of viruses that only infect bacteria but won't infect you. But the microbiome, it's all of that, all of it combined, and all the different germs, they interact with each other. They produce different things that affect their little microenvironment. So it's really very complex. And each different part of the body, it forms like a different biome, as you would call it in Minecraft. So each different part of the body, so the scalp or the skin on the back of your arms, or your colon, all of them, they have different conditions, so different temperature, acidity, different chemical composition, and that all affects what bacteria and everything else can live on there. And even within one part of the body, like you might think, so the mouth, within the mouth, you might think, okay, that's one biome, right? But it's not. It's even more complicated than that. So you'll get slightly different compositions of germs. So you might get one kind on your tongue, or different kinds under the gum line, or in the nasal cavity. It's quite different again. So I'm not going to get deep into the weeds in what types of things live in there, because there's just so many names. There's so many names. But just get sort of getting into the thinking about each part of the body, the condition, just like in a rainforest or something. All the local conditions will affect what can live there, and none of the biomes are really separate from the neighbouring ones. So like in the body, you could think of it like in terms of maybe like a river. You've got sort of food coming in at the top, and it's passing through different environments as it goes down your throat, stomach, intestines, and then the other end. And everything that comes in, it all has an effect. So in the teeth, around about the teeth and the main part of the mouth, you can get more than 700 species of bacteria living in there, which is absolutely wild. And so they've all got they eat different things. Some are good for you, some are maybe not very good for you, might sort of irritating. There's far too many to list, obviously, right now. So I'm just going to tell you just mention these two that can cause quite a lot of problems for some people. So Candida albicans, that's a yeast, so it's fungal. That's what causes like oral thrush. So that's quite a lot of a problem for people who are immunosuppressed. So things like steroids, or any kind of immunosuppression, that can so it's a normal part of what lives in there, but if it overgrows a lot, then you can have a lot of problems. It can get really quite sore, and then you have to have some special mouthwash. And it's also a problem for people that have dentures, because it can be quite difficult to really keep everything like squeaky clean, and it can overgrow. There's another one that can be quite bad for you, Streptococcus mutans. So that's the main one that's involved in tooth decay, and it's quite insidious because it gets into all the little corners that you can't reach very well with your toothbrush, and it produces like it makes like almost like a little sort of horrible little nest in there, and it can be quite difficult to deal with. And it eats that's the one that really likes the sugar in whatever you're eating, and it produces the acid that causes tooth cavities. These are a couple of bad guys. There's plenty of other good guys as well, but I'm not going to get into that. So when you're thinking about this sort of ecosystem, this little world, something like the mouth or the intestines, they're like a rainforest. There's lots and lots of food and rain. There's loads of biodiversity and lots of things living in there. Whereas the lungs, they're a lot more like a desert. So there are things living there, but there's just a lot less of it, and there's less diversity. So the sort of round about your the pharynx, like the back of the throat, the sort of the top of where the trachea comes off. After that point, you get a lot less biodiversity and just massive living things. You get sort of a steady stream of whatever's living in the mouth will come down into the lungs, especially sort of round about the sort of the throat and the very top of it. And that includes Aspergillus. There's a bit of Aspergillus living in the mouth, not a lot. It's not a major player, but a little bit of it can come down the throat. That can cause a bit of an issue, say, if somebody's in intensive care, if they want to do grow cultures from the lungs, you can get a bit of Aspergillus sort of contaminating it. So that's why sometimes you have to have a bronchoscopy, which obviously it's no fun for anyone, but they need to get really, really deep into the sort of the normally almost sterile part of the lungs to check whether the Aspergillus is really growing down there. Because if you just sort of take swabs from like round sort of pretty much the back of the throat, sometimes there can just be mouth Aspergillus sort of contaminating it, and then it gets complicated whether to give somebody antifungals or not. So that was a big concern during COVID, because people in ICU with COVID are at this extra risk of invasive Aspergillus infections. So the take home from this is just the mouth has a lot of bacteria, lots of diversity, and the further you go down the lungs, the less and less and less and less you get. With Aspergillus, the tricky part is it's not the bit that makes you guys ill with the chronic aspergillosis. It's not that it's coming from your mouth. It's spores that you're breathing in. They're already airborne, and they go right the way into the bottom of the lungs. So that's not to do with the mouth, and you can't really avoid that apart from by not going near compost. Other sources of spores. So it's like any ecosystem, it's quite a dynamic system, and there's a lot of factors. It changes quite often, and there's a lot of factors that as you get older, there are quite a few factors that will change what's growing in your mouth, and that can have a knock-on effect on your respiratory health. So this is sort of why I've brought this up, is not so much the Aspergillus side of things, but it's more of a keeping well generally, and keeping your lungs healthy more generally talk today. So some of the factors are, as you get older, you tend to produce less saliva, and that's a problem because actually your saliva, it controls the little ecosystem. It has compounds in it, like little peptides that selects it kills some bacteria and favors other ones. And if you're producing less of that saliva, you're not controlling the levels of the bad bacteria so well. And like we talked about before, biofilm formation on dentures, it can be quite difficult. If you have GERD or reflux, that kind of thing, that's all changing the composition, like the chemical and sort of like what sort of foods and substrates are inside all your throat and comes back up to your mouth sometimes, which is no good. Diet, depending on what you're eating, obviously, like we all know, like lots of sugar is bad, but we still eat it, don't we? And dental hygiene.
What diet you're on.
Yeah, definitely, yeah. Dental hygiene, obviously that has a big effect on how much bacteria is in there. One thing that we don't normally think about. Hang on a second. You have to excuse my voice a bit today. I had a bit of a cold earlier this week, and my voice doesn't sound normal yet. Sorry about that. So as you get older, your swallowing muscles tend to weaken, and so that sort of affect everything that's going on in your mouth. And also, if you've got steroid medications, that can affect it as well. So things like if you take a steroid inhaler, you definitely want to make sure you've got good technique, so you're not getting the steroid on the inside of your mouth and sort of rinsing afterwards. And if you aren't sure about that, that's definitely something to ask the nurse or your GP or somebody about getting that just right. So and part of the problem is it tends to be as you get older or as you get more unwell, it gets harder and harder to keep on top of all of these factors all at once. And so once you get several of these factors flipping a bit, your mouth can get worse. So some of the things that can lead to is just inflammation. Especially things like Streptococcus mutans, they are quite irritating. You can get quite red gums, and just your immune system is affected by that. There's more of a risk of pneumonia and aspiration pneumonia, just because if there's bacteria sort of being shed, if there's a lot more bacteria and more is going down your throat into your lungs, the chance of one of them causing an infection is just higher naturally, especially while you're in hospital. That is quite a risk. If you have sore teeth, it can get quite difficult to eat properly, and especially as people get, so like my poor granny, she doesn't have a lot of teeth left, and she gets quite restricted what she can eat and what she can't eat, and we do worry about her getting the full range of so she gets visits from a nutritionist who gives her all strange milkshakes. So it can be a bit insidious. It can creep up on you over time a bit when you're eating differently. You can have a weaker sense of taste if you've got a lot of stuff living in there, especially salty and bitter flavours. And don't worry too much about the last two on this risk. They're not as immediate. So in pretty rare circumstances, if you have very, very bad teeth, you can get bacteria sort of go through your bloodstream and cause infections elsewhere in the body. Probably don't worry too much about that. It's unless it's not a common thing to happen. And there is starting to be some data suggesting that your risk of Alzheimer's disease can be greater for people that have got quite teeth in bad condition. But that's at a relatively early stage in the research. So that's not one to get too hung up on at the moment. There's a couple of links there.
There was a conversation we had a few months back with a couple of people in the support group, and they didn't have enough saliva. I think it was, and it was pointed out that you have to let your dentist know, because you're much more prone to cavities and things like that.
Very much, yeah.
I can't remember why they had less saliva. It might have been a reaction to a drug.
Yeah.
Something about, I can't remember. Sorry, not much help.
You produce less naturally as you get older, but yeah, quite a few medications will do it as well. Yeah, I've got a medication that it gives me. It means what, sorry?
Less dribbling.
Oh, yeah, I guess that's the upside, isn't it? Okay, so just a few ideas for things that people could try. So if you already have really good dental care, this just carry on. Well done. But it's one of those things that it can slip a little bit, especially when you're having a patch where you're not very well. But just to reinforce that it is very important. So if you haven't had a checkup for a while, just get on. it's really, really, really important to have a good look in there. NHS recommends about every 6 months, but definitely every 2 years. Some dentists, if it's been more than 2 years, they will deregister you. So that really is a problem. Sorry, I'm just going to close the window because it's very noisy.
I was deregistered during COVID. Practice shut.
Okay. Yeah, it's easier said than done finding a dentist. Just keep trying, basically, unfortunately. And if they recommend that you go to a hygienist, it's definitely worth doing. Don't think, don't really have time. Yeah, it is. It's a good thing. For the saliva, obviously staying hydrated is very important. If you know you don't drink quite enough water, then that's a good place to start. And also, chewing sugar-free chewing gum can be quite good for getting a bit more saliva going, and that can make really quite a big difference. If you don't already use floss and mouthwash, those things you can try. If you want more specifics about what types, probably just ask your dentist. I'm not an expert in those, but there's a lot of options, even just in the supermarket. Give them a go. Another thing that can get forgotten is the tongue. There's a lot of bacteria on the tongue because the surface of it, with all the little taste buds, it's quite bumpy. It's sort of a very rough surface. You can get a lot more bacteria build up than you think. And if you think that might be an issue for you, there's different options. Some people sort of give their tongue a little bit of a scrub with a toothbrush, or you can sort of scrape the bacteria off. You sort of start at the back and then work forwards, and just be careful. Don't make yourself gag or anything. You can buy tongue scrapers, but you can use just a spoon, just a metal spoon, the edge of a spoon, and it works quite well. That's what I started doing, and I was absolutely horrified how much bacteria there was on my tongue. Even after I'd brushed and mouthwashed, there was still, it was gross, and it felt a lot better afterwards. Like, I could taste my food better. It was just a lot more comfortable. And the other one that nobody likes being nagged about is if you smoke, that has a big effect on what bacteria are in your mouth. And if you can quit, that's great. If you can cut down, that's also good. But it will be having a big effect.
There is a bit of a caveat over the cleaning your tongue. People tend to get a bit obsessive about it.
Yeah, don't go nuts.
And you end up with a very sore tongue.
Yeah, don't hurt yourself.
Yeah. Beth, can you hear me? Yeah.
Yes, I can hear you.
Right. I nebulise an antibiotic, and it was always stressed to me how important it is to clean your teeth and rinse your mouth after you've nebulized the antibiotic.
Yeah, definitely.
So it is important that. Yeah.
Which antibiotic was it? Do you remember?
It's colomicin I nebulise.
Yeah. Yeah, and like the same with inhalers and things.
You're better off with a spacer for that reason, aren't you, with an inhaler? I don't know whether the same goes for nebulizing, but
no. I have a mouthpiece. On the nebulizer, and it has a filter on the end of it as well. Yeah.
Did you notice it changing much about your mouth while you were taking it, or was the spacer worked well enough?
Well, with the colomicin, no, sometimes you get a funny taste, but I've used it for so long now, but yeah, I've nebulized other antibiotics as well, tobramycin and gentamicin as well, and the same applied to them, but they had side effects which were not very good. So yeah, but they did say to me, and even my dentist said, I mean, even I see a hygienist every 3 months, and the dentist every 6 months, but yeah, they've never said anything untoward about what they can see. Yeah.
Oh, that's good. Okay, that was all I was doing. I'm done.
That's interesting, though, isn't it? The flora of the mouth is obviously got a lot to do with what you eat as well. So, and we've been told for decades, stop eating. Well, don't let sugar rest in your mouth for too long, because that'll encourage the Pseudomonas to produce their acid, and your saliva's not getting in there to neutralize the acid, so you end up with cavities in your teeth.
Yeah, well, that Streptococcus mutans, that's even more aggravating for that, because if you eat sugar, even if you straight away brush your teeth, while the sugar's there, it can grab a load of it and store it. So even if the sugar's just in your mouth for a second, it can grab what it needs and then sit there all day fermenting it. Horrible.
Some people might enjoy something auto-fermenting the alcohol.
Oh dear.
I used to know there was a man, probably, I was going to say an old man, but he's probably about my age, when I was a teenager, and he was a smoker. And I can't remember why. We used to talk to over the fence, and I remember being fascinated by this colour of his tongue. And it was sort of a very dark brown. And yeah, I presume that was a lot of. I think it was. For some reason I'm thinking it was cigars rather than cigarettes, but I'm not sure now. But I've also worked with a dentist when I was doing my PhD. Well, a few since, and that illustrated another problem with the microbiome in the mouth. In the gap between your tooth and your gum is quite a big pocket called the gingival pocket, and it fills up with. If that fills up with particular species, then they produce a lot of something called proteases, which dissolve the connection between your teeth and your gum and your bone gradually. Yeah. And that's what he was working on. He was trying to culture these proteases so they could recognize them and do something about them. If they could get rid of those or persuade them to go away in some way, you can imagine the difference that would make in a lot of tooth loss, because a lot of tooth loss is around this gradual degradation caused by these bacteria in people's teeth. I was wondering, is there any hint yet of how we might treat this kind of thing using what we know about the microbiome in the mouth, like giving us particular species to drink or something like that?
There are papers out there where people have tried that and say, yeah, it works great. I don't think it's going to happen anytime soon. I think it's much more about just keeping all the surfaces really clean. It's boring, I'm afraid.
The dentists wouldn't like that, would they?
I don't know if it makes people's teeth better. I think that.
Yeah, but then there's less money for them, then, isn't there?
Yes. Charge a lot for the mixture of bacteria to fix your teeth.
Yeah. I mean, things like lactobacillus, like the sort of yogurty things, they're quite good at pushing out the bad bacteria. But I don't think the trouble is once everything's formed a sort of a thick biofilm, they can't get in and do much.
Yes, that's a big issue. And I suppose the mouthwashes, which are based on alcohol, some of them, if I remember rightly, would help to dissolve that biofilm a little bit.
Yeah, you need to find one that, I think some people find that a bit irritating though, so it's just finding one that works for you.
I've only ever tried one, and I think it had alcohol in it, and it wasn't at all pleasant to use.